Baltimore General, an episodic medical drama. Written by Blue Bolton. Episode 1, Transfer of Care, Chapter 5. The worn leather couch in the doctor's lounge sagged beneath Emilia as she collapsed onto it, her first 12 hours at Baltimore General weighing on her shoulders. Burnt coffee mingled with antiseptic in the air, a strange cocktail that had become her perfume over years of medical practice. She kicked off her shoes and let her eyelids fall, savoring the momentary sanctuary of silence. Well, look who survived day 1. Tabitha Ross stood framed in the doorway, steam rising from 2 cups clutched in her hands. One side of the nurse manager's curls had flattened the only betrayal that she'd been powering through a 16-hour shift. Barely, Emilia admitted, fingers wrapping gratefully around the offered coffee. Thanks for this. Hospital coffee's terrible, but it's terrible in a familiar way. The couch dipped as Tabitha settled beside her with a deep groan, stretching her legs forward. These compression socks are a lifesaver, but damn if my feet don't feel like concrete by hour 14. Emilia's lips curved upward, warming to Tabitha's unguarded manner. They'd connected instantly during orientation 3 days ago, Tabitha's direct warmth somehow penetrating the careful walls Emilia maintained. So, Tabitha studied her over the rim of her cup. That was quite the first day. Most new attendings get a twisted ankle or maybe an appendectomy. You got the medical mystery with our resident surgical genius breathing down your neck. Lucky me, Emilia murmured, though curiosity flickered in her voice. Tabitha's knowing glance made Emilia shift in her seat. Shaw doesn't usually invite new attendings into her OR, you know. Not on day 1. The case was similar to one I saw in D.C. So I heard. The whole hospital's heard by now. Emilia winced. That fast? This place runs on 2 things, medicine and gossip. And some days, the gossip moves faster. Tabitha paused. Speaking of D.C., want to tell me why you really left? The question caught Emilia with her defenses down. The professional answer sat ready on her tongue. Career advancement, new challenges, but something in Tabitha's direct gaze dissolved the rehearsed response. I needed... Emilia's eyes dropped to her coffee. Space. Silence. Tabitha waited, her silence an invitation. My husband, Preston, he's a corporate attorney. Very successful, very driven. Emilia's finger traced the rim of her cup. Our Georgetown house echoed with voices every weekend. Clients, partners, political connections, dinner parties, charity galas, fundraisers. Sounds exhausting. It was, but that wasn't the problem. Emilia's chest rose with a deep breath. The problem was when everyone left, and it was just us. The house was still loud, with everything unsaid. Understanding softened Tabitha's eyes. And then there was the Grace Hanley case. Emilia's voice dropped to barely above a whisper. 16-year-old girl, multiple hemorrhages, blood work all over the place. She died before we could figure it out. The hospital wanted to move on quickly. Preston thought I was obsessing, said it was affecting our social calendar. Charming, Tabitha muttered. So I applied for transfers. Told him I needed professional growth. He didn't fight it, didn't even ask why Baltimore. Emilia looked up. I wanted silence. This hospital is not silent. The statement hung between them, layered with unspoken meaning. Baltimore General pulsed with chaos, demands, intensity, everything D.C. had been, stripped of its polished veneer. And yet you stayed, Tabitha observed quietly. Emilia nodded slowly. And yet I stayed. Through the lounge's glass wall, Dr. Shaw strode down the hallway. her black scrubs a stark contrast against the hospital's sterile palette. Her eyes fixed on her tablet, every movement precise and economical, authority radiating from her posture. Emilia's gaze followed longer than necessary, noting the confident rhythm of Shaw's steps. When she turned back, Tabitha watched her with a raised eyebrow and the ghost of a smile playing at her lips. "Yeah," Tabitha said dryly. "Silence my ass." Heat crept up Emilia's neck. "I don't know what you mean." "Honey, I've been nursing for 27 years. I know attraction when I see it." "It's professional curiosity," Emilia protested. "She's brilliant." "She is that," Tabitha agreed. "She's also trouble with a capital T." "I'm married." "You said that like you're reminding yourself, not me." Tabitha's voice softened. "Look, I'm not judging. God knows we all need something to keep us coming back to this place. Just be careful. Sloane Shaw has a history." Curiosity flickered across Emilia's face despite herself. "What kind of history?" Tabitha hesitated. "Not my story to tell, but it's why she keeps everyone at arm's length, why she's always in control." "Except in the OR today," Emilia mused. "There was a moment when she seemed, I don't know, like she recognized something in Jordan's case that scared her." "That's interesting." Tabitha tilted her head. "Shaw doesn't scare easily." "Neither do I," Emilia said, surprising herself with the steel in her voice. Tabitha smiled. "No, I don't imagine you do, underneath all that politeness." She glanced at her watch. "I should check on 4B before handoff. You heading home soon?" The thought of her empty apartment with its fortress of unopened boxes made Emilia wince. "I think I'll check on Jordan first. His mother's eyes were hollow earlier. Might see if she needs anything." "Always the caretaker," Tabitha observed, rising with a groan. "Just make sure someone's taking care of you, too." Emilia smiled but offered no answer. She'd stopped expecting care a long time ago. After Tabitha left, Emilia lingered, coffee warming her hands as she gathered her thoughts. The day had spun around her from the moment Jordan arrived in the ER to the tense differential meeting with Bird materializing unexpectedly. Something about this case had everyone's skin prickling, and Emilia couldn't shake the feeling it threaded somehow back to her past. Her phone sat heavy in her pocket. She pulled it out, hesitating before checking her messages. 3 texts from Preston glowed on the screen. "Hope your first day went well. The Andersons asked about you at dinner. Call when you can." No questions about how her body ached after standing for hours. No genuine interest in her new life. Just social updates and a perfunctory check-in. Classic Preston. She slid the phone back without responding. Rising from the couch, Emilia navigated toward the ICU. The hospital corridors had quieted, daytime chaos replaced by night shift's more measured rhythm. She nodded to passing staff, faces and names still blurring together. Outside Jordan's room, she paused at the wall-mounted tablet to review his chart. His vitals had stabilized post-surgery, but platelets remained dangerously low despite transfusions. The latest neurological assessment showed minimal brain activity concerning, but expected with his sedation. Through the glass, Marla Hall's body slumped in a chair beside her son's bed, one hand clutching his while the other held a worn paperback. The image tugged at something raw in Amelia's chest. She entered quietly, footsteps soft on the linoleum. "Mrs. Hall, it's Dr. Carter from earlier." Marla looked up, exhaustion carving deep lines around her eyes. "Any news, doctor?" "He's stable for now," Emilia said, moving to check Jordan's monitors. "How are you holding up?" "I'm fine," Marla answered automatically, then sighed. "Not fine, terrified. but I've been here before with Jordan. Different hospitals, different crises. Emilia's pen light flashed across Jordan's pupils. Has he had bleeding episodes before? Nothing like this. He's had nosebleeds, bruises that appeared from nowhere. Doctors always said it was normal for active boys. Marla's eyes tracked Emilia's examination with weary vigilance. Last month, his gums started bleeding when he brushed his teeth. That's when they prescribed the Vascatril. Emilia's hands froze mid-motion. For bleeding gums? For migraines, Marla clarified. The doctor said the bleeding was probably just him brushing too hard. But Jordan had been having these terrible headaches, crying, rocking, hitting his head against walls. Since he can't tell us what's wrong, the Vascatril helped? Like a miracle. No more headaches. He was calmer, happier. Marla's voice cracked. I thought we'd finally found something that worked. Emilia squeezed her shoulder gently. We're going to figure this out, Mrs. Hall. I promise. Dr. Shaw said the same thing, Marla said. She seems intense. She's the best trauma surgeon in the hospital, Emilia assured her. Jordan couldn't be in better hands. She asked a lot of questions about his medication, about where we got it. Marla's brow furrowed. Is there something wrong with the Vascatril? Emilia chose her words carefully. We're exploring all possibilities. It's too early to say anything definitive. But you've seen this before. It wasn't a question. I heard the nurses talking. A similar case, Emilia admitted, but every patient is different. Did that patient survive? The directness pierced Emilia's professional veneer. She considered deflecting, but saw the determination burning in Marla's exhausted eyes. No, she said softly. She didn't. But we know more now, and we caught Jordan's condition earlier. Marla nodded, absorbing this without visible reaction. Thank you for being honest. You should try to get some rest, Emilia suggested. There's a family room down the hall with cots, or I can have someone bring you a recliner. I'm not leaving him. Of course, Emilia mentally flagged to have nursing bring in a more comfortable chair. Is there anyone we can call for you? Family? Friends? It's just us, Marla said, gaze returning to Jordan. Has been since he was 3. The quiet dignity in her voice resonated in Emilia's chest. She recognized the solitude of caretaking, how it narrowed your world until sometimes all that existed was the person you protected and the endless tasks of keeping them safe. I'll check back in before I leave, Emilia promised. Try to rest when you can. She was almost to the door when one of the monitors shrieked. Emilia spun around, instantly alert as Jordan's heart rate spiked, then plummeted on the screen. What's happening? Marla bolted upright, panic threading her voice. Emilia lunged to Jordan's bedside, eyes darting across the monitors. His blood pressure dropped before her eyes, oxygen saturation falling with it. I need a crash cart in here, she called toward the nurse's station. And page Dr. Shaw. The monitor alarm changed tone, its urgent beeping collapsing into a single, continuous wail as the heart rate line flattened. Code Blue, ICU Room 4, announced the overhead speaker. Code Blue, ICU Room 4. The room suddenly flooded with staff nurses wheeling the crash cart, a respiratory therapist rushing in, the on-call resident appearing in the doorway. Emilia moved with mechanical precision, emergency training taking command of her muscles. Starting compressions, she announced, positioning herself over Jordan's chest. She pressed down, feeling ribs yield slightly beneath her palms. Get his mother out, please. No, I want to stay. Marla's voice broke as a nurse firmly guided her toward the door. 1 milligram epinephrine, Emilia ordered. Charge the defibrillator to 200 joules. She continued compressions, counting under her breath, each second ticking in her head. Brain damage began after 4 minutes without oxygen. Jordan had already weathered too much trauma today. Epi's in, a nurse called. Rhythm check, Emilia said, pulling back. The monitor showed ventricular fibrillation, a chaotic, useless heart rhythm. Shock indicated, everyone clear. Bodies stepped back from the bed. Emilia pressed the defibrillator buttons, and Jordan's body jerked under the electrical current. Resume compressions, she ordered, hands returning to position. Where's Dr. Shaw? On her way, someone answered. Emilia cycled through the ritual compressions, rhythm check, medication, shock. The room swirled around her in coordinated chaos, every person focused on restarting Jordan's heart. Second shock delivered, the resident announced. Still in V-fib. Sweat beaded on Emilia's forehead as her arms burned with effort. She maintained the steady rhythm, muscles screaming in protest. Come on, Jordan, she whispered. Come back to us. The door swung open as Shaw entered, eyes immediately scanning the scene. How long? 2 minutes, 17 seconds, replied the nurse, keeping time. Shaw moved to Emilia's side. I'll take over compressions. I've got it, Emilia said, rhythm unbroken. Shaw nodded, respecting her command of the code. What medications have been given? 2 rounds of epi, 1 of amiodarone, the resident reported. Get another amiodarone ready, Shaw ordered. And I want platelets and fresh frozen plasma. His coags were already a mess. Emilia completed her set. Rhythm check. They paused, all eyes on the monitor. Still nothing. Shock again, Shaw said. 300 joules this time. Clear, Emilia called, delivering the third shock. The moment it delivered, her hands returned to Jordan's chest, her world narrowing to the feel of bone beneath her palms, the count in her head, the desperate hope that each push would jumpstart his heart. Time? Shaw asked. 3 minutes, 40 seconds, came the response. Emilia felt Shaw's eyes on her. Carter, switch out. You're tiring. I'm fine, Emilia insisted, though her muscles screamed. It wasn't a suggestion, Shaw said quietly. Switch. Reluctantly, Emilia stepped back, letting the resident take over while she gulped air into her lungs. Shaw moved beside her, both women staring at the monitors. What happened? Shaw asked. No warning signs, Emilia said. He was stable 1 minute, then his pressure bottomed out and his heart stopped. Could be a clot, could be hemorrhage. Shaw's voice remained clinical, but Emilia caught the undertone of worry. Where are those platelets? Coming up from blood bank now, a nurse called. 4th round of compressions complete, announced the resident. Rhythm check. Everyone froze, eyes fixed on the monitor. For a terrible moment, the line remained flat. Then a blip, another. A fragile, irregular rhythm appeared on the screen. We've got a pulse, Emilia said, fingers finding Jordan's wrist to confirm. The beat fluttered weakly beneath her touch. BP's coming up, 80-40. The room's atmosphere shifted from desperate urgency to cautious relief. Hold the shock, Shaw ordered. Continue the amiodarone drip. I want an ultrasound in here now to check for internal bleeding. As the team stabilized Jordan, Emilia's eyes found the clock. 22 seconds. His heart had been stopped for 22 seconds from the last rhythm check until the return of pulse. 22 seconds that could mean the difference between full recovery and permanent brain damage. 22 seconds that Marla Hall had spent in the hallway, not knowing if her son lived or died. Good work, everyone, Shaw said, her eyes meeting Emilia's briefly. Something electric passed between them: acknowledgement, respect, shared concern. I'll talk to his mother, Emilia offered. Shaw nodded. I'll stay with him until the ultrasound is done. We're not losing him again. The determination in her voice mirrored what burned in Emilia's chest, a refusal to let this case become another Grace Hanley, another name that haunted her nights. As the code team dispersed, leaving only essential personnel with Jordan, Emilia stepped into the hallway where Marla waited, her face frozen in terror. He's alive, Emilia told her immediately. His heart stopped, but we got it started again. Marla's knees buckled, and Emilia caught her arm, guiding her to a chair. Oh God, thank you, she whispered. Can I see him? In a few minutes, Dr. Shaw is ordering additional tests to find out what caused this episode. Will it happen again? We're doing everything we can to prevent that, Emilia said, honesty the only comfort she could offer. Marla nodded, composing herself visibly. You kept your promise, she said. You're still here. The simple observation caught Emilia off guard. How long since someone had noticed her presence, acknowledged her commitment to stay? Preston certainly hadn't, not in years. I'll be here as long as Jordan needs me, she said, the words settling in her chest like a vow.